Hey guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Venlafaxine, also known as Effexor. It is a kind of a newer antidepressant on the market. On the expensive side, if you can afford it, it's great. If it's not, there are other substitutes out there that are cheaper that are just as good. It is for any kind of mood disorder, manic depressive disorder, panic disorders, off-label uses, meaning it's not FDA approved. You can also use it for like neuropathic pain, although you generally don't see that. You take drugs like duloxetine instead, Lyrica, things like that, and Celebrex for neuropathic pain instead, but you can use this as well. So if it ever works out that you have neuropathic pain and you're kind of depressed, then maybe this works. But you generally use duloxetine instead, but you can use this one as well. All depends on your doctor, what they're comfortable with. You can take it with or without food, doesn't really make a difference. Actually, no, I'm sorry, I'm wrong. You have to take this one with food. Gotta take this one with food. If you're on the extended release, you're gonna see a max effect, you're gonna see it start to kick in about 6 to 8 hours. Let's see here, for immediate release, you'll kind of start to feel it kick in about 2 hours. It's an SNRI, selective serotonin norepinephrine reuptake inhibitor. I always fumble that. Essentially, it increases serotonin in your brain and norepinephrine in your brain. You increase both of those, it makes you happier. And then with the norepinephrine aspect in there, there's that secondary mechanism of it kind of curing neuropathic pain as well. But I won't get into that too much. Again, this isn't really used too much for that. It's really used for the mood part of it all. If you have any renal or liver issues, you need to make sure you let your doctor know, because both of these go through both avenues, and so we don't want to stack too many medications going through your kidneys or through your liver, because then you have problems. You don't want your kidneys and organs, your liver to fail. So let's see here. It has a black box warning for suicidality. We talk about this in other antidepressant videos we've done. Anytime you're on an antidepressant like this one, it can increase suicidal thoughts. Why does that happen? We don't know. We don't understand that mechanism, but it does. It's a bad side effect. If you start to notice yourself or someone you love who's on this medication start to have increased amount of those thoughts, then we need to call the doctor. We need to get you switched on to something else or get your dose lowered. That's safer. Because it works in your brain, you don't want to abruptly stop this medication. It will cause bad withdrawal effects, so the longer you've been on it, the worse the withdrawal will be. Also, the longer your tapering cycle will be. Tapering meaning that you take a little bit less each day, or every few days you just take less and less of a dose, and you get your body used to not having as much in there until to the point where you're down to such a low amount that your body can do without it. If you've been on it for years, it'll probably take several weeks for you to really come up off the medication. If you've been on it for a few months, then maybe a 2-week dosing taper period is more than enough for you. Consult your doctor, make sure you have that conversation with your doctor. And then let's see here, beyond that, what haven't we covered? Oh, list of side effects, I'll put them right here. Overall, generally a very well-tolerated medication. It doesn't have a really crazy side effect profile. Generally very safe to take. It does cross into your breast milk, and it does cross into the placenta. So make sure that, I believe it's a category class C, which means it can go either way. There's not enough studies to kind of determine whether it harms the fetus or not, but you need to have that conversation with your pediatrician and with your OBGYN, depending on which phase you're in, and discuss whether being on this medication is the safest for you. I think that's about it, guys. Relatively pretty easy, relatively pretty good. If you have any questions, concerns, please leave them down in the comments. Give us a like, give us a subscribe. We're really trying to do good with these videos, so show us some support. And yeah, we'll see you guys next time on Meds Made Easy. Bye.